Hello, good morning. So I'm gonna perform incentive spirometry. So first and foremost, we always check the patient's chart for any information that needs to obtain. Once inside, we introduce ourselves to the patient, and then we also make sure we check the ID band for confirmatory purposes. And then once we check up the patient, we make sure we introduce. Aside from introducing ourselves, we always try to explain to them what's the purpose of this one, such as telling them that this therapy is what we call incentive spirometry. So the purpose of this is it would help you prevent your lungs from being collapsed, prevent any atelectasis, relieve your airway from any secretions, and it would also help you cough more and also expand your lungs even more. So once we did those, and also for checking the ID band, we always make sure you obtain vital signs or pre-assessment. Make sure we always include auscultation, which is important during this incentive spirometry. Once we're done, we also have to position the patient sitting upright if they can, or if not, they can adjust the patient's bed. And if some instance patients who just came from surgery who would for sure experience any pain, we should have a pillow in front of them where it would help support so that they will not experience too much pain. And then another thing is, with this device, we make sure we check for any cracks, especially on the bottom. It might have been fall down, so if there is, make sure we replace it with a new one. And then every time we do a therapy, we always wear gloves, PPE, and then we have to set the ideal volume or pressure for the patient by looking at the patient's age and height, such as this one. So for example, I will be the patient, so based on my height and age, so I will be about almost 2000. So we should always dial it, this one, the yellow thing, by setting it on this appropriate volume or pressure. And then we always hook it up with this mouthpiece, and then when holding this one, they should hold it upright like this. And then before starting the therapy, we always do a demonstration so that the patient would understand. So first is we have to let the patient exhale all the air out until their lungs are empty. After that, put this mouthpiece inside. Make sure there's a tight seal with their tongue underneath. It should not block the mouthpiece. Once inside, let the patient take a slow deep inspiration, and then after that, when the white piston would rise, and then let the patient take a inspiratory hold for about 3 to 5 seconds, and then after that, allow the white piston to drop, and then remove the device or mouthpiece and exhale away and then normally. So exhale all the air out. So after that, let the patient take a rest for a few seconds, and then ideally, they say it's ideal to do this about 10 times per hour, but for initial attempt, for those patients, especially the elderly one, I prefer to start it about 5 breaths per hour, so that way we should prevent any complications such as lightheadedness, discomfort, or fatigue. And then later on, if they can tolerate it, we can gradually increase it so. And then another important thing with this is we should also educate the patient to let them use this one every hour, so that way it would help them expand their lungs even more. And then once you're done, you should put this one inside back to the plastic bag, and then with this mouthpiece, you can wash the mouthpiece in a sterile water, allow it to air dry, and then cover it with a clean tissue cloth, and then put it also on this one. So another thing is, every time we do this incentive spirometry, so put it to the side, we should always do a vital signs post assessment, and then every time we do vital signs, always perform an auscultation, so that way we should always take note if there are improvement of their breath sounds. So potential outcomes for this therapy is it would help relieve atelectasis and improve breath sounds, and also it would expand their lungs even more, And then once everything is done, remove our PPE, reposition the patient, make sure they're comfortable. Then once outside, make sure we chart whatever the initial trial of the patient and communicate with the staff.